Hello, my name is Taekyung Hairston, and I am a pediatric resident at the Johns Hopkins Children's Center in Baltimore, Maryland. Thank you for giving me the opportunity to present my research at SAEM. Today, I will be presenting our project titled A Traumatic Pandemic, High Acuity Pediatric Trauma in the COVID-19 Era. I have no disclosures. COVID-19 has shifted the utilization of healthcare resources in many different arenas, even during the beginning of the pandemic. Decreased utilization of emergency department services during the pandemic are being seen globally. These trends may be reflecting a collective fear of hospitals as highly infectious zones and the downstream effects of quarantine and self-isolation. There is a growing body of research looking at how chronic illness in the adult population are being exacerbated during the COVID-19 pandemic. But our question was, are there changes in trends of non-chronic medical problems such as traumatic injury? Limited data exists on the changing epidemiology of high acuity traumas in pediatric patients during the COVID-19 pandemic. The objective of our study was to identify changes in the numbers and types of traumas presenting to a level 1 pediatric trauma center during the COVID-19 pandemic compared to prior years. Our hypothesis was that changes associated with the COVID-19 pandemic have significantly altered the number and types of traumas presenting to a level 1 pediatric trauma center. So we compared high acuity trauma visits, which we defined as traumas requiring admission, emergency surgical intervention, or resulting in a fatality, presenting between January 1st through September 1st, 2020, to corresponding months in 2017 through 2019. We then stratified trauma visits by level of acuity, injury zip code, and mechanism of injury. We also compared trauma diagnosis trends with mean ED visits during the COVID-19 pandemic versus previous years. We evaluated changes in mechanisms of injury, injury severity score, and area deprivation index, a measure of socioeconomic disadvantage during this time period. Data were analyzed using longitudinal time series analysis, t-tests, and tests of proportions. Out of the 480 traumas from January to August 2020, 227 of them were high acuity traumas. The average ISS was 9.8. High acuity assaults were from the most disadvantaged areas. Physical child abuse cases were from almost all ADI state deciles. And this first graph shows high acuity traumas by month with lines corresponding to different years. And you can see by this graph that high acuity traumas declined significantly as a state of emergency was declared to a nadir of 16 in April 2020. And as restrictions were lifted, high acuity traumas significantly increased and surpassed previous years to a peak of 40 visits in August 2020. This second graph demonstrates that high acuity traumas as a proportion of total emergency department visits were higher from March to August 2020 compared to prior years. And this table demonstrates that we also found that there were significantly more visits for high acuity assaults and suspected or confirmed physical child abuse, but fewer for falls, drownings, and motor vehicle accidents from March to August 2020 compared to prior years, while visits for animal attacks remained stable. And so our findings show a potential increase in assaults and physical abuse during the COVID-19 pandemic, associated with documented increases in mental health crisis and socioeconomic stressors. Further research is needed on factors associated with interpersonal violence during the current pandemic, and these findings may be used to guide public health measures on safety and injury prevention as the pandemic continues and further restrictions are debated. I want to acknowledge my principal research mentor, Dr. Badaki, for all of her help, as well as the rest of our COVID Kids trauma team. My references are listed here, and I am happy to take any questions you may have. Thank you again for this opportunity.